Well, Dr. Brandt, I am very, very grateful to have you here today. Thank you so much for joining us on the You're Not Alone podcast. I'm excited to talk about the treatment of severe OCD. But before we dive into that, can you just give my audience a quick introduction on you, your journey to becoming a clinician, and why OCD? I mean, why choose this path?
Yeah, absolutely. Well, thank you very much for having me here. Really excited to talk about OCD as always, and you can just call me Chad. That's fine by me. So I decided that I wanted to be a psychologist when I was a senior in high school. I took AP psychology at my high school, and I loved it. And went to Florida State University. I took every psychology course they had. My last semester, I took like oceanography and things. I'd run out of psychology courses. And I had always wanted to work with anxiety. I was a very anxious kid. I didn't realize this until I was in college, but my stomach hurt every day in kindergarten, every day in first grade, all the way through until I was in college. And I realized, wait a second, the rest of you don't feel this way all the time? I thought all of our stomachs hurt just constantly. It was part of being human. It's not. Okay, well, I must have anxiety and then I should figure it out. And then once I do, I should help people with that. So I just did all the psychology work I could in undergrad, and then I went straight into my Ph.D. I was fortunate enough to get into a program studying anxiety and substance use. So that's where I thought I could do some good. Why do people use substances? Generally because they're anxious or avoiding some feeling. And how do we understand anxiety such that we can help people feel better and get back to their lives? Went to grad school, did that for a little while. That field just wasn't for me. So I shifted over to working with people with anxiety and chronic health conditions, specifically HIV and AIDS. And I thought, well, this is an underserved community. These are people that need help that aren't getting it. I can help. So I worked series of HIV clinics in the city of Houston. That was my dissertation and all those things. And then I wanted to transition away from that. It just didn't feel like a great fit for me. So I did my postdoc at the Baylor College of Medicine, or my internship at Baylor College of Medicine in the Houston VA. And I did PTSD work, primarily in health and anxiety and veterans. And I thought, well, this will be great. This is where I can do a lot of good. And it was there actually that I was introduced to whole day PTSD treatment. So there was a little study going on where we would take groups from an ACT, acceptance and commitment therapy perspective, and take them for whole days. And that was eye-opening for me. I'd be walking around the halls of the VA after doing a couple of the groups, and the guys would flag me down and run up to me and tell me how great they were doing. After just the day, they were all surprised, the ones that did well. So I thought, wow, this is really cool, but I don't know if veterans is for me. I don't know if this is the group I want to be in. I don't know if I want to work for the VA. So my postdoc, I was fortunate enough to get a job at the Houston OCD program, which is now the McLean OCD Institute of Houston.
There you go.
And that's where I really felt like I found it. I love OCD. It's fascinating. Every case is exactly the same and completely different, and that's really cool. And it can take... I found what I like is taking somebody who can be quite high functioning, who then gets just completely pulled down to completely non-functional. And then to get them back up to a high level of functioning is really, really cool to me, versus working at the inner city clinics. And I worked at severe mental psychiatric illnesses and people with psychosis and things. And you're kind of getting people on and off the streets. And that's really, really meaningful. And I loved that work. And I just it wasn't as rewarding to me as taking kind of one person at a time and really getting them their whole life back, whatever that looks like for them. So that was for me where it started, was the Houston OCD program. I worked there for a couple of years, really, really loved it. And then a group from Norway that does the Bergen 4-day treatment came down and did a training with us at the Houston OCD program. And I was one of the Americans that learned the Bergen program. And that was whole day treatment with OCD, right? And it took me a little while to wrap my head around it, but once I did, it really clicked. And I told my wife, I said, this is how I have to do treatment. It was actually after the first Bergen group. So I shadowed, a few of us Americans shadowed some Norwegians doing one of the Bergen 4-day groups. And it ended, and I cried. And I called my wife and I told her, this is what I have to do. This is what I have to do for the rest of my life.
Yes.
So did that for a while. A year maybe, and then the pandemic hit, and the Norwegian team went home, and everything was in flux, right? The clinic had been bought, and the Norwegian team was gone, and the pandemic was here, and I couldn't see people in person, but I knew that this was the way I had to work with people. So I started my own practice. It's just me, And right now, primarily, I work with people just one-on-one, just me and one person at a time in kind of half-day to whole-day increments. It could be 2 days, it could be 4 half-days, it could be 5 whole days. Just depends on the person. But just getting one person and with severe OCD and finding what they need to get them back and get them functional. So a long answer to a short question, but that gets me to where I am now.
Yeah, you've had a long winding road to where you are now, and I find that first off, I can feel your passion, and I love that. I can tell that you genuinely care. You actually want to help people.
Yeah, I do.
You do, and it's amazing to see, and it brings a smile to my face, and I'm grateful for that. So I really want to let you know that means a lot to me. I could also understand how, I have a special place for veterans in my heart. My only connection is just that I have family and friends that have served, and I know that people come back and they struggle with all sorts of challenges. And so I do feel that that's a community that a lot of meaningful work can be done in. And it sounds like you got that experience, and PTSD is a very real thing, and veteran suicide is a very real thing. But I also know that OCD can be extremely debilitating, and I am one of those people that you described as high functioning in the world, and boom, within 6 months, I was quite literally the it was like I was a shadow of who I once was. I was completely anxious, deeply depressed, suicidal ideations. And it's interesting. I wrote this down. You're talking about your stomach hurting from the anxiety. Yeah. I took Prilosec OTC for 4 years.
Really?
4 years, every single day.
I went.
I'm not even kidding you, Chad. I got an endoscopy, scope down the throat,
wow.
a colonoscopy. People can connect the dots there. All before I had graduated college. Yes. And no doctor could figure out. They would look in they were scoped up in my stomach, and they would be like, it's a little inflamed, it's a little red, but other than that, there's no ulcer in here. We don't know what's going on. And literally, and of course, I didn't know that the stomach aches were from the anxiety. As soon as I started treating my anxiety, the stomach aches, treating the OCD, my anxiety went down with the OCD treatment, and then my stomach aches went away, and I completely stopped taking Prilosec OTC. And that was a moment for me, not to go off on too big of a tangent, where I realized, obviously, doctors are very, very important. And especially, I think, clinicians such as yourself, psychologists that understand the brain at a really deep level, I think is really, really important for healthcare. Because I do think that there's just this huge gap still that's just completely being missed. Like when I was severely anxious and deeply depressed at the start of this OCD journey, I went to my family doctor, and immediately he just wrote a script for antidepressants. Nothing wrong with that. But
it's not what you needed at the time. And he did the best that he could, but there's this big gap right there, right? Who's going to catch you and say, I think you've got OCD. And that's what's going on here.
Yeah, I think you have OCD. And even some of the psychologists that I went to before I found Dr. Irene Wagner that didn't know how to diagnose OCD. So to me, it means a lot to have you in the space and treating people. So I wanted to call that out. Okay, so you said something that I've never heard of before. The Birkin 4-day treatment. I'm curious, what is this? What is this? What are the Norwegians teaching us here? I want to learn more about this.
So it's a treatment they've been doing in Norway for, 10 or 15 years now, thousands of patients. It's been a few years since I've really been in contact with them, so I'm sure there's thousands more. But it's just the model that they use in Norway for treating OCD is if you have OCD, you go see one of these therapists. They do them in groups. It's normally 4 or 5 patients and 4 or 5 therapists. And it's 4 days. It's 4 days of treatment. You block off 4 days of your work calendar. You show up for 4 days. You get all the ERP, everything you need, and then in theory, you go about your way. You don't need long-term follow-ups. You can get them if you need them, but you've got the tools. You've done the exposures. You can go about your way now. And they've had some really, really great results doing the treatment that way.
Wow. Okay. So, I understand sort of doing like an all-out blitz on the OCD, if you will, to use some sort of an analogy people can understand. I could see why that would be really valuable. Could you break down or help me understand like what those 4 days sort of look like, what the flow and process is? I don't want to make assumptions, but I'm assuming exposure and response prevention is a part of that.
Yep. So I can tell you what kind of my experience is now. So when the Norwegians went back to Norway when the pandemic hit, kind of the connection to the States was severed at the time, and then I started my own practice. It's been a couple years now, so I don't want to speak to what they're doing at this time because I'm not exactly sure, but I can speak to what I would do at this point. And if I were to take a patient for 4 days, let's say, I mean, there's a little bit of psychoeducation at the beginning. Who are you? Who am I? What are we doing? Why are we doing it? Right? Let's give us a treatment plan and understanding a goal, an end goal. And then it is just a lot of exposure therapy. And I would say one thing that I have found in working with the Norwegian team and in doing the whole day kind of ACT model of PTSD treatment and in what I do now is the exposure therapy needs to be, I would say, meaningful than difficult. And those two things can absolutely overlap. But it's not about just push, go, harder. Sometimes you do need to do that. Sometimes that's a part of it. But a lot of times it's push on something, take a step back, take a breath. What's happening here, right? What's the messages that you're sending your brain? Can we take a step back and try that again with a new message? Try that again differently. Try that again more fully. Try that again with really leaning into it, right? And sometimes you'll take your time with a small item to really, really get it right, to really, really show the OCD. As you would know, and as anyone listening would know who's done exposure therapy and found success, there's a flow to it. There's a consistency. There's a groove you hit. Right. And in sports I used to play, you'd play basketball and every now and again you just felt like you couldn't miss a shot. And like there's an OCD equivalent to that. Right.
Best feeling in the world, by the way, was when you were just in a flow and you just could not miss a shot. It's nothing like it.
Yes. And you can hit that with exposure therapy too. That's, I see it. I'm seeing in the matrix. I see what the OCD wants. I see what I can do about it. I see how I can get a step ahead of it. And here I go. Right.
Yeah.
And you can, when you have extended time with people and when you're more focused on, I would say, doing exposures right than doing them hard, though again, I would caveat that overlaps a lot, you can hit a similar state. Oh, this is how it should feel. This is how it would go. This is what living without OCD would feel like, isn't it? I could go touch whatever doorknob I wanted to, couldn't I? I would just really grab it and pull it and walk in and rub my hands and move on and here we go. And then when you have a whole day or a couple days with somebody and you can get them in that state over and over and over and over, they can normally carry it home with them. Yeah. Really, really well.
I could see that. The question that comes to mind is when you're doing the couple day intensive, is that virtual or is that all in person?
I tried some virtual I would call it kind of middling success. When I think about doing an exposure with somebody, it's really a whole body experience. So if I'm asking somebody to touch a doorknob, right? Sure, I'm asking them to touch a doorknob, but I want their hand fully on the doorknob. I want to fully engage in the exposure, and I want their hand, their body open. I want their body relaxed, not touching it like you're about to get punched.
Yeah.
That sends a weird message into the brain, right? Relax your body, grab the doorknob, and then I want to be able to say, and what's going on in your head as you do it? Because if you're sitting there thinking, everything's going to be fine, everything's going to be fine, everything's going to be fine, you're feeding the system a little bit, right? You're doing great on the outside of your body, but you're feeding the system on the inside. So I want the whole picture is what I found with people. I only do the treatments in person now. I wish I could. Do it virtually. It would probably be easier for people, but it should be right instead of being easy, right?
Yeah, I agree. So let's take a step back then, because I think that you brought up some really important points. To the person who just clicked on this episode and knows nothing about OCD or exposure and response prevention, can you just give the listener a high level on what OCD is, what exposure and response prevention is, and we can kind of go from there?
Yeah, happily. So OCD, the O of OCD would stand for obsession, and obsession is an unwanted thought that comes back over and over, even if we don't want to have it. The C stands for compulsion. The compulsion is the thing we do to get rid of the thought. And D stands for disorder, and that basically means it bothers you and interferes with your life. So someone with OCD would have repetitive, unwanted thoughts. Could be about anything. They're normally taboo topics. Germs, sex, drugs, rock and roll, alcohol, right? Yeah, all those things. Murder. Pornography, et cetera, et cetera, et cetera. you have any kind of theme to the thoughts, but there's normally a theme the OCD likes to click into, or the brain likes to click into.
Yeah.
So yes, I've now decided that germs are dangerous, and if you touch germs, you'll die. Great, there's my click, right? Death. Okay, if I touch, then I die. There would be obsession. The compulsion would be don't die. It would be don't touch the germs, right?
Right.
Disorder would be it interferes with your life. Well, now crap, I can't leave my room. I can't leave my room. I can't touch the doorknob. It's now a disorder. It's now interfering. The treatment for OCD, the most effective treatment that the literature would say, is exposure with response prevention. So exposure, go expose yourself to the feared stimuli, go touch the doorknob. Response prevention, don't do anything about it. Basically, don't fix it. Don't wash your hands afterwards. One of the ways that I would frame exposure therapy to patients is, you're really kind of calling the bluff at some point is what we're aiming to do. If my OCD tells me, Chad, if you touch that doorknob, you'll die, most people with OCD at some level would say, I know that this is kind of silly. I know that this probably wouldn't happen. I know if my wife came in here and touched this doorknob, or my son came in here and touched this doorknob, they wouldn't die. But, right, I might, and I don't want to take the chance. There's a little bit of a catch in there where we kind of know that something's going on that logically doesn't make sense. And then what do we try to do? We try to logic ourselves through it. And you end up thinking through an OCD problem over and over and making it worse. I don't want to think through it. I just want to dare it to come true. Right? So I would tell the patient who's afraid of touching my doorknob and dying to try to be dead. I'll give you 10 seconds and try to be dead at the end of the next 10 seconds touching my doorknob. And if you are dead, I'm sorry, I'll send flowers. If you're not dead, hey, maybe the OCD has lied. And maybe if it's lying here, maybe it's lying somewhere else. I don't know. What do you say? What do you say we go chase it down and see? And then there's an angle there of exposures. Now, I suppose I'm picking a rather difficult one to start with if I think of dying. But the angle would be the same.
It's actually, it's funny that you say that. I don't know if a lot of people would be able to put their finger on it right away, but I did. I read this book about the core fears, like the 5 core fears that every human being has. I don't know if it's on my bookshelf back here. I can't remember the title of the book, but basically it was like loss of purpose, loss of meaning, and somehow those were differentiated. I can't remember how. Loss of love, death, and then there was one more. I can't remember what the 5th is, and I've mentioned this a few times, so I'm gonna have to look into the book after this. But they basically, the author was a psychologist. He talked about doing the downward arrow technique to uncover what is the core fear that you have that drives all of your anxieties. Now, obviously with OCD, when you're struggling with intrusive thoughts, you're not digging into the why behind those. That is just going to send you down the spiral. Why did I have that thought? What could that mean? You and I both know that is a road that leads nowhere quickly. Yeah. What I liked about the downward arrow technique is just that when I went through it, so I could pick any fear, any anxiety that I had, and I would just ask myself, well, why is this upsetting to me? Or like, what am I afraid would happen next? And then I would answer that question, and I would write that answer down, and I would do it over and over and over again. Where it led to every single time for me was lack of purpose, loss of love, and then if I took it one step further and I asked again, well, why am I afraid of lack of purpose, for example? The next answer for me would be, well, then I would have no purpose in my life anymore, and there would be no reason to be around. So then I would say, well, why is this upsetting to you? And then and then my answer, my brain would pop up would be, well, you'd be dead. And it was the same thing with loss of love. Well, why is that so upsetting to you? And I think it was like, I'll end up alone and afraid. And it was like, well, why is that upsetting to you? And my brain went right back to, you would die.
You would be dead. Yes. And there's a track that it'll click into. That's like the best way that I can conceptualize it myself, right? Yeah. And when you can find that, then the exposure itself doesn't matter as much. It's more about, am I hitting the OCD there? Yes. Where it hurts, right? More so than how many doorknobs did I touch today? It could be 1, could be 47. I actually don't care. Yes. Did you hit the OCD there? Right? Did you dare that to come true?
So that brings up the question that I had, because earlier you said this is what the textbooks say you're supposed to do. do you have a spin on the way that you treat OCD then, and the way that you approach it, and is what you just talked about how you go about treating it?
Yes, and I can get into the weeds a little bit for anybody that wants. Please don't Google this ad infinitum.
I want to get into the weeds.
Yeah. So the way most people would treat OCD in the States, that for the intention behind exposure would be habituation. If I ride the wave of anxiety, the anxiety will come up and then it'll come down and I can do it again, and so on and so on and so forth. Habituation is fine. Habituation is good. The stats would show that works really, really well for 50 to 60% of people with OCD, which means 40 to 50% it's not working as well for. The angle that I like to take with my exposures, I would call the inhibitory learning model.
Okay.
Again, if you wanted to Google. And the inhibitory learning model, the idea behind it is exposures are more about what you're teaching your brain and less about how you feel. Feelings are just kind of a side effect. And if they come and go and you habituate, that's almost a happy accident. It can happen. I'm okay with it. That's fine. But I'm much, much, much more invested in and interested in, did you send the right message into your brain right now? Right? Are you teaching your brain something different? And so if and I know this is a podcast, but if someone's afraid of a water bottle, and I say, well, let's do an exposure and touch it, and they touch it just barely with the outside of their pinky, they're doing an exposure, they'll habituate, their anxiety will come up, their anxiety will come down. All of that will be lovely. And the way they do that sends this kind of mixed message in, right? It's safe enough to touch, but it's only safe enough to touch this much at this time. And so what about next time? I don't know. And then you have to replicate it, and your brain's kind of confused, and it kind of kicks back to the beginning. Right. It says, oh, no, it's scary, and it gets hard again. Right. And at some point, people get worn out of that, in my experience.
Yes.
Right. And they'll say, I've already touched this water bottle 47 times. I don't want to do it again. Yep. And I would argue, some people would say, well, do it more and that'll work. And it will. And I would argue, well, let's touch it differently. And that'll work. Right. But that would come back to, well, if I use my downward arrow technique, what I ask patients all the time is, why would that be bad? Right. If I touch it, I'll be anxious. Well, why would that be bad? Right? We all feel anxious. Why is that bad? And you'll get down somewhere, right? The water bottle will kill me. Lovely. There it is. Okay. Yep. Let's use the water bottle to kill you now. Not with, I'm not going to beat you over the head with it, but what does the OCD say you can't do?
Yes, absolutely.
And now you've got a different angle on your exposures. And there's a lot of freedom to that, I think, for some people. Some people really are helped by habituation, and it's lovely. Some people, this clicks in their brains a little bit more effectively, I find.
Yeah, so it's interesting, and obviously I'm not a clinician, so I want to be delicate. I guess I didn't know the technical term, and it's inhibitory learning model is what it's called. And as far as I know right now, you can't find like a therapy book that says these words directly. It's kind of a newer model coming out in the literature and things, but yes. Okay, because I'll tell you, Chad, that is... I mean, at a certain point, I realized, and I think it was because my therapist told me acting is a big part of this. And you mentioned that with the body language. And hey, when you touch the doorknob, your heart might be beating through your chest, but demonstrate to your brain through relaxed shoulders, relaxed jaw, as relaxed as you can possibly get it. That, hey, and then when you touch the doorknob, again, it was interesting you brought up the pinky, and I did not struggle with contamination was a part of mine, but mine was more intrusive thoughts around sexual orientation and things of that nature. Was, if you're going to grab the doorknob, grab it all the way and grab it with confidence, even if you don't feel a shred of confidence in your body at all. And that, to me, is what you're describing is beneficial, because I have seen videos of people doing exposures where there's like this video of this young woman like trying to touch this food that like she doesn't like, and she's like shaking the entire time, and she touches it with her finger and then pulls it away and like has this freak out moment, and everybody like huddles in around her. And when I saw that video, I was like, that is not... Again, this is my opinion. I want to be clear. I don't want people to get upset.
Sure.
But to me, I was like, that is not a good exposure. Like, she actually what she just taught her brain was that was a scary experience, and that her brain should be freaked out by that.
And it's terrifying, and you need 7 people to come help you cope afterwards or whatever, right? Yeah. And you don't. I don't think so anyway.
No,
I think people,
yeah.
it's always so interesting to me. People with OCD are so tough. To go through what you go through mandates a level of toughness.
Yeah.
To sit up thinking for 24 hours straight, to wash my hands until they bleed, to wear gloves in public even though everybody gawks at me, right, do any of these things takes a certain level of toughness. But the OCD will flip around and say you're not tough enough to touch a green bean. Well, I'll censor myself here, but forget that, right? Like you just took a 24-hour shower. You can tell me you can't touch a green bean? It's a green bean. Come on. Let's get in here and let's rub that green bean on ourselves and let's really see what happens here. I think it's lying to you. I like a language like that sometimes for people. But no, I would agree with you. And I'll tell patients a lot of times, I'll say, I mean this in the nicest way, but I really don't care how you feel.
Yeah.
In that, it doesn't matter.
Yeah.
I don't think it matters. I don't think it matters if that doorknob scares you or not. You need to touch it as if it's not scary.
Yes.
Right? And then there's a freedom to that will come sometimes.
Yes. And what's interesting, and you touched on this with the habituation, and I actually think that this is the gotcha that gets people stuck, is like people go, if I do this, then I will no longer feel that.
Then I'll feel better. Mm-hmm.
And they sit, and this is why I've had this conversation till I'm blue in the face with friends of mine that have sexual orientation OCD. Mm-hmm. And I tell them, it's like, look, man, you not wanting to ever feel or have an intrusive thought, never want to feel anxious again, and never wanting to have an intrusive thought ever again is signaling to your brain that some thoughts are okay. Yes. Yeah. That they matter. Yeah.
Yeah. That's exactly right. And I could even take like that idea and what I might tell somebody, and again, I'm just making up examples off the top of my head. But I might tell somebody, okay, if you're worried you may or may not be gay, just close your eyes and I'll give you 30 seconds and just try to be gay. Just try to find boobs really, really gross, right? If you're a male attracted to women or whatever. And the good news would be, well, if you can turn yourself gay in that manner, I would assume you could just turn yourself back. If it's that easy, well, there you go. You can just do it. But I don't think you can. I don't think you can do it.
I've actually never heard that said before either, by the way, where if it's that easy to turn, I've never heard that example before. That's
I don't see why not.
Example.
I don't see why not, right?
Yeah.
But now I'm testing, right? And now instead of saying, well, how many gay thoughts can I tolerate today? I'm saying, okay, brain, go ahead. Let's go for it. And I can take even that example. If I were to just move this around and I were to take somebody with harm thoughts and they were to say, well, what if I walk around the mall and I just punch somebody in the face and I get in trouble? I would say, well, great, let's go to the mall and let's just walk around and just empty your mind and just say, okay, brain, if you're really a bad person that's going to punch people in the mall, go for it. Please, 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 please just go ahead and go for it. I generally don't think you will.
Yes.
But I don't know. Let's take the shot. Let's see what happens. And I would encourage everybody to do these ideas with the help of a therapist, with some guidance, right? Such that somebody can see you on the outside. You know what's going on the inside. We know what's going on the outside, and then we work as a team to put that together. So I think that's I'm jumping topics a little bit right now, but there's a decent deal of literature that would say that guided self-help for OCD is not nearly as helpful. And it's because you've only got half of the story, right?
Yeah.
You've got what's going on in here. You don't have what's going on out here. You need both.
What do you mean by what's going on out here? Explain that. Is that the expertise of the clinician, or what do you mean by that?
Oh, partially. It's just mostly having eyes on your outside. What's really going on? And I might have somebody that gears themselves up and they work really hard and they get through the first door. We might go to the Dillards at a mall and they really push their hand on the first door handle and really get through and they feel proud, and then they bump their shoulder into the second one. Hold on. Time out.
Yep.
This isn't about winning one doorknob. This is about Derek the OCD with all the doorknobs. So take a step back. Let's go through both doorknobs again here, right?
Right.
And doing the one and not the other is a fine exposure. It'll help you. It'll do good. That's all fine. I'm not into doing good. I'm into beating the crap out of OCD, right? Such that it doesn't come back anymore. So let's go use both of these doorknobs. And then let's run through the store and find another one too, just to really hammer it home. So it would be seeing the little things like that. Or, hey, I saw when you had your hand on the doorknob, your other hand was actually outstretched fully behind you. Did you notice that? No, you didn't? Yeah, it was. Let's try it again. Put both hands on it, right? So you'd have somebody on the outside seeing the holding back.
Okay, so that was really helpful. On that note, you had talked earlier about like somebody holding a doorknob, for example, but in their head going, "I'm fine, I'm fine, I'm fine, I'm fine. This is fine. I'm gonna be fine."
Yeah.
So let's talk about mental compulsions, because that's something that you can't see that I know has kept a lot of people stuck. I mean, I'm sure that there's stuff that I do still that I could, every podcast I learn something new. But what are mental compulsions for people new to the OCD world, and what are some of the ways that we mentally compulse?
Yeah, so if I think about the O of OCD is obsession, unwanted thought, the C of compulsion is the thing we do to make the thought go away. I can try to think a thought away, right? I can have a thought right now that my wife is off having an affair. Now she would have had to found a babysitter in the last hour to run off and do it, but it's possible, right? So I could have that thought right now, and part of me could say, well, I'm just going to pull up my phone and check my iPhone or whatever it's called, right, app, and see if she's home. Or part of me would go, no, my wife's fine, everything's fine, she loves me, right? Both of those things would make that feeling go away, would make that thought go away. So they're both compulsions. One's outward, I'm checking my phone. One's inward, I'm telling myself that it's fine. I'm making a joke about her getting a babysitter. That you even might consider that a compulsion. I'm doing something to make it go away, right?
Yes.
And so it can, again, this is how OCD would look the same, but different in everybody. A compulsion could be so many different things. Basically, the filter to run it through is, did that make me feel better? Did that make the thought go away? If so, probably a compulsion. In terms of therapy, in terms of working through it, my angle of handling that would be exactly the same internally and externally. I would just want to force that thought into my brain so many times that it probably loses its meaning. Loop tapes is something that you can find in some of the therapy books. If you're not familiar with a loop tape, you would take an unwanted thought, my wife could be having an affair, or my wife is having an affair, or I don't know, anything, take something along those lines. You've got an intrusive thought. And I could phrase that a little bit differently, actually. What if my wife is having an affair? That's a good catch-all for an OCD thought, right? What if? What if I'm gay? What if I murder somebody? What if I die from cancer from this thing? What if my wife is having an affair? A what if thought is just a big old rabbit hole. Because if she is, well, then how am I going to find out? And do I trust my wife? And what if she loves me? And what if I don't love her? And what would I do? And what about the kids? And do I hire a divorce attorney? Right? Infinity thoughts can run through that. So I would take a what if thought and I would change it into an uncertainty statement, which would be the first thing I said, which would be, what if my wife could be having an affair? Right? She could be. That could be happening right now. And I don't think that thought is important. I think my brain is trying to get a hold of me right now. I think my brain's trying to mess with me. I'm not going to let it mess with me, so I'm going to show it that this thought isn't as dangerous as it seems, and I'm just going to sit here and go, my wife could be having an affair, 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 my wife could be having an affair. At some point, those words go from big and scary to just sounds.
Yes.
Right? And now I've sent that message into my brain 52 times if I had to. Hey, there's a thought. I can feel it a bunch until my brain seems to get bored, and then I can move on with my day. Now, I still don't know whether or not she's having an affair. I still have uncertainty. I still don't feel great. I don't like this example. I should have come up with another one for myself.
No, this is great. This is really, this is this is good stuff. I mean, you're even getting into an example, so this is helpful.
And now I've sent the message into my brain that says maybe this one isn't that important, and I can move on with my day. Now that my brain has let go a little bit, I can actually move forward with my day. Right. And now I move forward with my day, and that sends a really nice message too. Even though my wife could be having an affair, here I am doing this interview.
Yes.
And my brain goes, oh, well, that must not be important. I'll stop asking him. Maybe at some point, that's the goal anyway. We have to see if it happens.
So I love that example so much, and I'm going to ask you to do it now with a couple other themes. Even though, so my belief is that my therapist said the content will always change, the way that you respond always remains the same, and the formula, just the example that you provided, was excellent. Let's talk this. I'm not gonna say names or specifics, but let me pull up a DM on Instagram. I get a lot of DMs from people. What about somebody? What say you to somebody who is struggling with sexual orientation thoughts. Now let me. Okay. What if somebody comes to you and says they have OCD and they're like, I'm really struggling. There was a recent instance where I watched a male and trans woman porn and got an erection, which completely freaked me out. I felt I was able to get over it because I felt it was because it looked like a woman, but it's come back in full force, doubting my intuition of it. What would you do as an exposure there? How would you coach somebody up?
Sure. So you've got a lot of questions there. Kind of what was going on? Why did you do that? Not to berate or anything, but what were you checking? Were you checking your sexuality? Did you just come across it accidentally? I don't know. So I'd want to get an idea of intention, but let's say we don't have that. And then we'd say, okay, so I'm stuck in a loop right now. My brain is telling me I might actually be gay, and now I have evidence.
Yeah.
Right. That would kind of be the concern there. Oh no, now it's real.
Yeah.
So there, I will say the content will change, but the response will be the same. I would agree with that completely. And then I would tack on to the end of that, we all also have roadblocks that pop up.
Yes.
And there's a couple of roadblocks that are pretty consistent for people across the way. And oh no, this one's real. But no, Zach, you don't understand. This one is real. That's right. I hear that. If I had $1.
Right. This time it's different. Every time I heard that one.
This time it's different. Right.
This time it's different.
I would just lean right on into that one. And I might almost loop tape it. That's a very thinky kind of obsession. I would never ask anybody to go have sex. I would never ask anybody to go watch porn. I don't ask people to do stuff like that, right? Yeah. But I would say, okay, it sounds like you're worried that you actually are gay. Well, let's loop it. I might actually be gay. 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 And I want to turn that thought into words. And then I want to say, okay, well, now that thought has it feels a little less sticky now. Can you have that thought carry with you as much as it wants to and go do something else? What else were you going to go do today?
Yeah.
Right? You're going to go to the gym? Go to the gym, even though you might be gay. I don't know. Let's go and see.
Yes.
See how it feels. And we're moving. With a thinky OCD like that, I want to move, not to avoid, there's an overlap there, but to send the message in to the brain that says, hey, I don't have to spend a lot of time on this one. This one isn't as important as you say it is. But I can show you by repeating it 27 times and then going out to the gym or whatever I was going to do.
Okay. So that was what I was going to ask. So the movement piece being signaling to the brain, this thought is not important. I'm going to go live my life and go do the thing that I was planning on doing before this intrusive thought took place.
Yep. And you get in the car and you go to the gym, and when you park at the gym, your brain grabs you right there and says, no. But this one's different and it's really real. Great. Okay, here we are. This one could be real. 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 Now my brain's a little bit bored. Let's get up. Let's go into the gym. You're going to carry some of the anxiety and stuff with you.
Yeah.
That's okay. That's part of this. That's part of treatment.
What about
it's hard to get better from OCD. It's hard to have it too, right? You're anxious either way.
Yeah, and in this example, just because I care about him and I want to see him recover. For some people with OCD, there's an event. Call it. Obviously, his intent with what he was watching was he was trying to get an answer. I know that, so I can fill in that gap.
Okay.
He was trying to get an answer, and he ended up getting an erection from the situation. And in my mind, I can put myself in his shoes as somebody with OCD to say, now he's all sorts of pretzeled in his head. What the hell just happened? Now I'm more freaked out. The response from the body, if you were his clinician and he brought that up to you, what do you say to that?
I usually just the word maybe. Golly, it's really hard for me to. I wish I knew every single thing about the human body and why it did everything it did. I'd probably make a lot of money doing some other job. I don't know. Maybe it means you're really gay. Maybe you were just really anxious and blood was flowing around to places. I don't know. Do you think we can take that uncertainty with us and go to the gym?
I love that.
Yeah,
okay.
I can't answer. I wish I could.
So it just completely hidden with the uncertainty. I love that. That's awesome. That was a really helpful example. And it's interesting that you touched on the never having to go, never tell somebody to watch porn, or because, I get DMs from guys, because sexual orientation was the one that I struggled with first, then it morphed into pedophilia, and it's gone into harm and rape, and I've touched them all.
Yep.
I mean, so I'll get guys that'll ask me, and I've got another DM pulled up. I won't read the specifics, but it's just like, Zach, do you think I should go to a gay club? What would you say to that as a clinician?
Oh, what's your intention there? Are you trying to get an answer? Are you trying to provide certainty to something that isn't certain? Yes. I don't know. What's the message you're sending to your brain here? Right? If you're going to waste a whole night responding to a brain question, you're giving that, you're teaching your brain, this is 6 hours worth of important. This is $100 and 6 hours worth of important, right? I would prefer right now to teach your brain it's not important and to have the whole system die down. And then if it turns out you're gay at the end of it, great. Now you can go do that if you want. But for right now, how do we send the message to your brain that that's not important? Right? So what else would you do? What else would you do? I don't know. And I might loop, there's a couple other kind of thinking exercises. I'm a big fan of ACT therapy, acceptance and commitment therapy. So there's a lot of cognitive diffusion skills, you could call them, you would throw at that. I am having the thought that I am gay. And I can still go see a movie with my friends. I don't know, whatever your plan was, right? Both of those things can live together. Can you carry it with you versus solve it right now?
Do you notice, do some people, because you talked about severe OCD, are there... Because with a couple of my friends that I really care about, and they're all over the globe actually. So whenever I do these interviews, I always have somebody in mind. So I'm picturing a friend right now. Are there, with the severe cases? Because for me it was scary. I mean, it was scary from the moment I did it, but I knew what the formula was, and I learned pretty early on that I was not going to get an answer. That certainty was just, it was off the table. And then, it was explained to me that, well, really certainty is off the table for everything. And that certainty is this facade that human beings think that they have.
Yeah.
We think we have control. We think we have certainty. But the reality is that nothing, whether you have OCD or not, is certain. You have actually very little control over anything in your life. And so once I realized that was the formula, I stopped. When I would do an exposure, it was like my mind switched. I was like, I'm doing this to serve a function. It is no longer to get an answer. I'm just doing this thing because I've been told that this is how you respond to these thoughts. And I had the framework of saying, I know that I can't gain certainty with anything, which is what you've been talking about. Maybe I will, maybe I won't. Saying it over and over in your head until you get bored. And it was like, my brain did get bored with all of the intrusive thoughts. But then I have friends that, and that's why I want to ask about the severe OCD, that they know the formula. I've even talked to them about, well, hey, when you're doing your exposures, what are you doing mentally? Are you doing mental compulsions? Okay, we identify, so that was a mental compulsion, right? Like, if you're looking at a guy in a Speedo and kind of cringing and looking away like this and going, I don't like it, but you're still looking at it, you're not going to get the results. Even just a suggestion of like, because obviously I know I'm not a clinician, but if a friend is coming to me in complete and total despair, I'm going to give them my perspective and just say, here's what I did that worked for me. Please work with a clinician, but here's like, if it were me, this is what I would do. And it doesn't seem to stick. Do you run into that a lot? How do you get people to get past the mental ritualizing and just getting so stuck on needing certainty? Are there just some people that are like, is it their cognitive flexibility? Is it just harder for them to like accept that it's just uncertain? Like, you're never going to have an answer.
Normally, I'm trying to find in my head like similarities across the severe cases, and it's hard for me to answer that. I would say that what will happen a lot of times with a really severe case is people will get underwater. I had an old mentor that would call it underwater. You get under there, you don't know which way is up, and you're panicking, and you're just thrashing about, right? And you can almost see it in people's eyes, right? And
Yep.
and they're asking you the same question 12 different ways or 12 different times in a row.
Yeah.
And usually what I find, if somebody is a broken record in front of me and I'm spinning one hand in one direction, then I just need to be a broken record in the opposite direction and kind of annoy them back. So he says, well,
Okay.
Chad, what if that means I'm gay? I would say, well, it might. I don't know. And they would say, well, what would happen? I said, I don't know. It might mean you're gay. And they would say, well, what if I am gay? It might. I don't know. And I'll just loop with them in an
Yes.
uncertain kind of opposite loop until
Yes.
they get frustrated.
Yes.
And then they get frustrated and they're like, you're not helping me. And I was like, there's Zach. Hi, Zach. It's me, Chad. It's really good to see you. You
Yeah.
won't believe what just happened. There was this OCD monster here that just wouldn't stop asking the same question, but it's really nice to see you here. Now that we're here together, what are we going to do?
Yeah.
There's a trance almost to it. And you just, insight is such a big part of OCD, right? Recognizing what is happening. That's another thing I might do is I might just say, do you see what's happening here?
Ooh, tell
Chad,
the audience
Chad.
about that. What is insight?
Yeah. So somebody can come to me where, let's say I've got a patient and we're in town and they're worried about being a pedophile. Let's go in that direction.
Yeah,
and
let's
they see
do
a kid. And they see a kid and they turn to me and they say, "Oh my God, Chad, I just had an intrusive thought about this kid," right? And I would go, "Well, Zach, do you see what's happening right now?" No, Chad, but this one's different. It's a kid and it was a real thought. Hey, I understand that. Do you see what's happening right now? No,
Yeah.
but this really means it's true and it's all going to be a disaster. It's like, yeah, maybe. Do you see what's happening right now? And eventually, if you can do that enough times, they'll go, what is happening right now? Oh, I had a thought and I'm treating it as if it's real. You are, aren't you? Okay. What do we do about thoughts? Instead of treating them like they're real, what else? What's an alternative? Right? Well, I could loop it a bunch of times, or I could scan and find every single kid in here and see every human being, or I could do some other therapy skill that we've worked on. Right? You got to break them out of the cycle a little bit. You got to have them having insight. Do you see what's happening here? If I had $1 for every time I said that one too.
Yeah.
I'd
It's
retire.
the OCD cycle, which is what you're talking about. And and I've been stuck in that cycle where it was I just asking the same question just with different variations. And
just looking for somebody to let me out. But the second I let you out, I'm not really letting you out. I'm just pushing you deeper in.
Absolutely. Yeah, you're just it's I always say you're stealing joy from the future self. You're stealing joy from who you could be in a week, who you could be in a month.
With a mental compulsion, there's really only one person that can get you out of that, and that person is you. I can say a bunch of fancy things on the outside here, but it's you in your head with your thought and your compulsion.
So how do you
Best I
start
can
to
do? Yeah, best
How
I
do you
can do
help
is show
somebody?
you what's happening.
'Cause
And
I wanna
ideally,
get people-
before that point, we've done some therapy skills, right?
Yes.
We've done some thought, some thank you brains. Some I'm having the thought that some cognitive diffusion skills is what I would call them if I could pull them from somewhere, such that when you see what's happening, then you use your diffusion skill. Now we're moving again.
Yes. For somebody listening, can you explain the OCD cycle, how it just works in a loop? Can you break down the simple mechanics of it so that someone could gain insight listening?
Yep. It would just start with usually a brain question. Is the way that I would frame it. What if? We could
what if
probably call
question.
it that, and that would be easy enough, right? Talk about uncertainty. So I mentioned to you before we started recording my middle son. He's 5 now. He was diagnosed when he turned 3 with type 1 diabetes, and it's very variable in little kids. So I just had an alarm go off, and my wife sent me a text. He's fine. Or not, or he died. Who knows?
Who knows? Maybe not, right? Playing the game. God,
Could
I
be
love
anything.
that.
Could be anything. I've got 3 kids. That's why you have a bunch of them, just in case.
Right? Hedge your bets.
So that's right. Okay, sorry about that. So step 1, of the OCD cycle usually is some kind of what if thought. What if something bad happens? Can start with a feeling, usually starts with a thought. I feel anxious. What if something bad happens? This doesn't feel right. Then it usually bleeds into, well, I don't like this feeling and I want to fix it right now. So I'm
Yes.
going to wash my hands, or I'm going to ask a question, or I'm going to do whatever. When you ask a question and somebody answers, you feel better. Okay. I thought that I groped that woman in the mall, and the person I'm with said I did not grope her. Whew, okay, I feel better now. So there's relief. That relief then sends a signal into the brain. The way I think about it is that whole process there tells the brain that the original question was important. I asked Chad, if you groped this woman, did you grope this woman? He panicked. He asked the friend. The friend also panicked. They all said it was okay, and they all moved on. That took 2 minutes. Golly, what an important question. So then the brain kicks the question up again 2 minutes later. The next woman walks by. Chad, what if you groped her? And then I panic, and I go, oh, no. And then I seek some certainty out in some way, and I get some certainty, theoretically, and I take a breath, which feeds the system back up to the top. And you can run that loop over and over and over and over and over infinitely, basically.
Yep. I think
and it's really hard to get out of it.
It is,
especially if you don't see it.
You took me right back to 2016, man. I mean, it was...
I apologize.
No, it's to me, this is all like, it's one big exposure, so it's good for me.
Yeah, that's right.
I just remember, it's exactly how you described it, which was intrusive thought, a what if statement. What if I've changed sexualities, right? Then it was attaching some sort of meaning to that thought. Whoa, where did that thought come from? Then it was reaction, heart pounding, like fear and doom starting to creep in. Then compulsion, which was a whole host of things, thinking back to previous encounters with females. Did I like it? Did I not? Calling my mom. And then getting reassurance either from myself or from my mom, and then getting temporary relief. And literally, the time in between the next cycle just became shorter and shorter and shorter and shorter, until you talk about being underwater. I didn't know what was up and what was down. I was so dysregulated. I had no idea what was going on. I was just in the machine, the machine washer. I couldn't get out of it. And I could have it wasn't until I met with like a psychologist to give me the insight to say, hey,
what's happening.
Could you be in the cycle right now? And let me explain what the cycle is. So I really think that was important for people to hear.
One thing that I'll tell, if you are a loved one of somebody with OCD listening right now, I'll tell parents and spouses and family members all the time, it's okay to say, I love you too much to answer that. There's love, there's support, there's togetherness there, but I can't.
Yeah.
I can't do that. I love you too much to answer that question. So I'm going to go over here. If you want to talk about anything else in the universe, I will gladly talk about that thing with you, but I can't talk about this. I'm sorry. Chad said some random guy in Texas on a podcast said I can't, so I'm going to go away now, right? But I think that's fine. I think that's reasonable. I think that's the best we can offer sometimes as loved ones. Because you're not going to fix it.
Yeah.
They're underwater.
Yeah. And there's no answer. There's no magic bullet. There's no this time when I get the answer, it's going to stick. And that was another thing too, that it just and that's why I wanted to ask you about the severe OCD cases that you treat. Because at one point I would have categorized my OCD as severe. I mean, I felt everything felt really intense. But then I learned, there is no silver bullet. I am not going to wake up one day and all of a sudden there's just going to be the answer. I guess it turns out I'm not a pedophile. I guess it turns out that I am actually straight. Like that day,
golden certificate floated down from heaven that said, "Hey, okay, we're good." Right?
And it's never coming. That's never going to happen. And I don't know why, but for me, it's just that's been so easy. Not so easy. Let me take a step back. I have gotten to a place where I have fully accepted that. But there just like I said, there just seems to be some people where that acceptance just isn't there. How do you get somebody to begin to accept?
It's scary and it's hard. I just make them an offer. Basically, you can continue living with OCD. You can continue doing what you're doing, and you can see where that would get you, right? But it's up to you. I'm not going to take your hand and force it into a bunch of trash cans. A, that's unethical. B, it would teach your brain that it's scary, so I'm not going to do it. But you can see where that would get you. You can also take my route here and go walking around the mall and swing your arms and see if you grope a bunch of people and take a chance. And we don't know where that'll get you. It might get you in jail. It might get you free from OCD. I'm not sure. So what do you think? Do you want this certainty of terrible that you have, or this possibility of terrible that I'm offering you? And usually it's just kind of an offer, and that's just a straightforward offer. That's not even, I'm not even doing a therapy trick or anything right there. That's just what OCD leaves you with.
Yeah.
Really, at the end of the day.
Well, and I can attest to that. I mean, the need for certainty is what drove me to not wanting to be alive anymore. I was like, if this is it, I'm out.
What's the point?
Like, this is, what's the point? And that rock bottom moment was me basically like, well, if this is where I'm at, if death is the option here at my hand, or death is the potential option from my worst nightmare coming true, I mean, I would rather at least I'll roll the dice and see what happens, because this other one is not a favorable choice for me. So I might as well try out this other option and just see what happens. And that was the deal that I made with myself.
Yes. Well, and I like that. I like that a lot. I like that you could get yourself there. And the hardest thing for me, what I've learned is, when I work with people intensively, when I work with people for, say, 3 days, they have to be ready. They have to be ready to work. They have to be ready to do hard things. We're not going to sit around and argue, basically, about touching a trash can for 2 of the 3 days. There's no utility in that. Yes. And I'm not going to let you touch a trash can with only 1 of your 5 fingers and then move on. We've sent the wrong message to the brain. I can't let that. That's not good therapy from the model that I do it. So I can't let that happen. So we're going to get stuck. So when I work with a patient, I do a lot of kind of pre-work on, are you at the point where you can do this? Are you ready? Right? And the hardest thing for me is to tell prospective patients, call me later. Here are some other options for you. You're not ready yet, and that's okay. I will always be here. Call me anytime. But if you're telling me you want to get better, but you'll never touch a toilet, then there's other people that would be better suited for you than for me. Right. And that's fine. And that is okay. And that is great. And the hardest thing for me is when that person ends up calling me a year later and they say, oh my goodness, I just wasted the last year sitting in my house. Fine, I'll touch the toilet. And they could have had that year back. But at the end of the day, that's up to them. That's up to all of us.
Yeah, I know, man. I have a little bit of this. I also feel like I know how to cognitively reframe it. But I do hear from a lot of people that have regret from time lost because of OCD. To me, it's wasted regret. It happened. I mean, it is what it is.
It did. And once you get better, then you can look back and you can take a breath and everything's fine. But I think there is a way out at the onset. And I wish everybody had it right now.
I know.
So we could all get back to our lives. Right.
Well, and I'll even be careful to say, because I have these friends in mind, and I don't want to put words in your mouth, but when you say that there is a way out, what you are saying is that you can reclaim your life without OCD running your life. This doesn't mean that all of a sudden one day you're going to wake up and you're completely cured.
Never have a bad thought again. Yes. Right. I literally gave you a bad thought about my wife having an affair 20 minutes ago. Right. And I'm an OCD therapist.
Yes.
Now I'm able to use it and give it as a joke and have fun with it. And I'll probably tell my wife later, hey, guess what? On the internet now you've had an affair. And we'll have a good laugh about it and move on. And that's where we all want to be. That's where we all want to be at the end of the day. And that's what I would say moving on would be.
I completely agree with that. I literally was having my wife's having affair thoughts on me yesterday.
Hey, there you go.
They switch up, man, and that's like what I try to explain to people. It's just when you start to give them weight, like I don't even engage with them anymore. Like I don't even go down the path one step at all. Like my reaction right away is like, she's been gone longer than normal. She said she was going to the gym. It's been 3 hours. She must be cheating on me. Yeah. And that's where my brain goes. And then for me, I go, well, yeah, she probably is. I mean, she probably is. Yep. This relationship is probably coming to an end, and it's going to be painful in the short term. You'll figure it out in the long term. You're a much more evolved human being at 31 compared to when you were 23 and knew nothing about mental health at all.
Yep. And then I can get back to my day, right? Oh, yeah, I was out planting flowers in the front yard. Great. Here I go again, right? And then you're back at your task in
Yeah.
theory there. That's what I would want. That's what I would want for people. Yes.
Okay.
And again, my son's little diabetes alarm was just going off and things like that's terrifying. I hate it. It used to keep me up at night more than it does now. But at some point he has to go to school. He has to go to kindergarten. And I have to say, okay, well, he's either going to live in a bubble in my house forever or he's going to die in kindergarten. Let's roll the dice and see what happens here. Right?
Yeah.
Right. And we give him his little monitor and we give his little juice and he goes about his way and there we go. Right.
Okay.
And it's still scary and I still have the thoughts and I can trust him and I can trust the school and I can trust the universe or God or whatever you want. And I can carry on.
Okay, so that's the last thing, and then I want to give you the rest of your night back. You just said trusting the universe. That has been a topic now that has been brought up on 5 out of the last 6 podcasts that I've done. Explain trusting the universe.
Yeah, I can use an OCD example, and then I can get into the universe. So we're always sending our brain messages. It's always asking questions, and we're always sending it messages back. And if I have a checker, someone who's afraid, someone who locks their back door 20 times on the way to bed, right? What's the message that they're sending their brain? They go, they lock the door, they get halfway to their bedroom, and their brain says, hey, hold on. Did you really check the door? Did you really lock the door? And they go, oh, no, I don't know. Well, let me go back and check. When they do that act of checking sends their brain the message that they're not trustworthy. I can't be trusted. I can't be trusted to lock my own door. How can I be trusted that my son has his diabetes medication? How can I be trusted that I didn't punch somebody at the mall? How can I be trusted that I'm not gay? How can I be trusted anymore? Right? And OCD loves to eat away at trust. And I think a big part of exposures, part of it is what are you pushing at? How are you bothering the OCD? And then part of it is what are you building up for yourself, right? And a big thing that I really like to focus on with people is some version of trust. Trust yourself that you lock the door. Trust yourself to make decisions. Trust yourself to call a pizza place and order pizza and hang up the phone and not have spouted racial profanities at them, right? Or whatever it is. Trust that God loves you. If I think about a scrupulosity type OCD, what if God hates me? What if I offended God and he goes to hell? Or I go to hell? We both go to hell. There's a certain level you won't know whether or not that's true. Right? No matter what you believe or anything, it could be the most devout anything in the world, and I don't have a golden certificate that has floated down that has said, Dear Chad, we're cool, love God, right? And at some point I have to say, well, I would believe that God loves me, of any religion or denomination or whatever. I would believe that God loves me. I believe that God would understand that I make mistakes and he would still love me, and I'm going to keep on trying my best, and here I go. And then we're moving again. But there's always an element of trust, I think, that you put into yourself or the universe or the world or something with OCD therapy.
I like that, and I agree with that. And I think that there's definitely self-trust that gets built with time, but there is something for me as I've sort of transcended past the initial part of recovery into the more long-term realm. There's something about trusting the universe that has really resonated with me, where it's just you're putting faith, almost just blind faith, that the universe is not malicious. It has your best intent in mind, that whatever you go through in life, there is a reason behind it. There is a purpose behind it. There's something better on the other side from those challenges. But by the way, this is a year or two new. So this part of my journey is newish. And there's something really relieving about that.
And it takes a risk to get there.
Yeah.
It takes chance, it takes risk, it takes anxiety, it takes something.
Yeah.
Right? If you're going to have the really cool experience of skydiving, you need to jump out of the plane. Nobody skydives with a tether to the back of the plane. It doesn't work that way, right? You have to take the leap, right?
Yeah.
Trust that the parachute will open. Trust the universe, right? And we all do this all the time, every day anyway. I drove my car today. You probably did too. I'm way more likely to die by car accident than I am by doorknobs, right? So I trusted the universe in that way. But I'm having trouble trusting it in this way, even though I'm taking objective risks, more in other ways. So everybody has this skill.
Yeah.
In one way or another, in one thing that they're doing. It's just a matter of actually getting them to see that that's a skill they have that they can they can place around in other areas of their life.
That's so powerful. Because even like I never thought about how you can just let go in your career. Like you can just let go of desire for certain outcomes, and you can just let go of the what ifs. Like even because I started this business, we're in year 3. So entrepreneurship is uncertain and unknown. And there have been times where I've just tormented myself, and I have to guide myself back to trust in the universe, man. Like there's a deeper plan here for you and for everybody else. And
Yeah, and then I would always follow up for people with OCD in particular. Now there's an action at the end of that, right? Instead of sitting here and worrying about whether or not my business will fail, I can do basically one of two things. I can do something to help the business. I can create a blog post or whatever. I can advertise on something, or I can let it go and say, you know what, I'm going to be better spent playing video games for an hour and going to bed and feeling more rested tomorrow. Both of those are actions in my mind.
Yes.
But sitting around and thinking about it really is not an action.
Wow. And for me, what resonated too was even the example of, or go play an hour of video games, because I also had this belief system that came in. I don't know how much of that was driven by OCD, that like while you were awake, every breathing moment, every waking moment, I should say, because you're breathing while you're asleep, you have to be working. You have to be working.
Maybe it's just an American thing I found. I don't know.
I think it is an American thing, man. It definitely is. I mean, we get inundated with that messaging, but it boiled down to control, the need for control and certainty and surrender to, for me, surrendering towards this idea that like the universe just has my back. And whatever is meant for me is meant for me. And however this is supposed to unfold is how it's going to unfold, has brought me so much peace. And it's funny because I didn't connect those dots, when in reality that is, in a sense, such a core component of OCD recovery.
Yeah, it is. And I don't think we talk about it in the OCD therapy kind of circles as much. It's why are we doing any of this, right? Sure, I don't have the gay thoughts anymore. Great. But then what?
Right.
When now what? And if you don't have a now what, it gets really hard to get better. And even if your now what is, I'm going to go play video games all day, every day, whatever. I don't care. That's lovely. I wish that could be my life some days.
Me too.
But what are you? Yeah, that's right. But what do you now what?
Yeah.
Right. And you need something, I think, to do. I went to Florida State for undergrad, like I mentioned, and Bobby Bowden always said he was never going to retire because the next big thing that happens after you retire is you die. And I kind of like, the idea of have a now what, and if your now what is go garden, that's fine. It doesn't have to be big, fancy, making money things. It's right. Why are we doing any of this?
Yeah, and I've actually learned even through this entrepreneurial journey that, I mean, the money it serves a function. It's there to put food on the table, pay the bills. You've got 3 additional mouths to feed, so I don't want to downplay money, but
maybe 2.
Yeah, right. Hey, maybe not. Maybe not. We'll see. Maybe not. We'll see what the universe has in store. But yeah, it's just, to your point, yeah, some sort of why, and then applying that sort of just letting go, trusting the universe, and then I love what you said, taking an action, essentially in alignment with your values. What's important to you?
Yep. If I get all acty about it, right? If I use my act therapy stuff, values. Why am I doing any of this? And then maybe at some point you notice, hey, wow, this is how the rest of people live. I'm just hanging out with my family, having a nice time. Wow, isn't this great? And then the OCD is going to say, oh, no, you don't. You might totally be a pedophile. And then you're going to say, I get what's happening here. Shut up. Get out of here. I'm hanging out with my family. And now you're moving again, right? Now you've kind of caught the system. Now you can do it. But it's hard and it's scary, but it's absolutely possible.
Yeah, it is. It is, but I agree with you. It can be challenging. Well, I have to say, Chad, I really enjoyed this conversation. I thought that
Likewise,
this was really beneficial. I always like to end with a piece of advice and then how people can connect with you. So to the listener right now, what is something that someone can do who's right at the start of their OCD journey to get started on their path?
Oh, it's a good question. And I tell you what I would say, And I'll tell everybody here the same thing I'm working on personally right now. And the thing I'm working personally right now on is making decisions faster, is moving faster. I'll have a note I have to do from a patient, and I'll say, it'll take 2 minutes, but I'm tired, and I'll just do it tomorrow. And and things build up. A million little things can build up. You don't have to take the biggest, hardest swing at your OCD to get started, but you do have to do something. Put your foot on the floor, wave your hand in the air, go walk out of your bedroom and flip the light switch off really quickly and keep walking. I mean, something quick. Is usually a really, really, really good place to start. So OCD hates speed. And then in terms of getting in contact with me, my website, drchadbrandt.com, drchad, brandt.com. It's got my phone number. It's got my email on there. My email is chad@drchadbrandt.com. Pretty straightforward. Anybody that's listening, call or email. I'm happy. I'm licensed in 20 some odd states. I've actually got a license in a handful of foreign countries.
Which countries?
Right now, working on Finland, almost done with the UK, and the EU has a license that should be coming relatively soon. Depends on a couple. We'll see how I do on the language tests, which is going to be poor. But something there should be coming through relatively, probably by the time this airs at some point. But I'm always happy to talk, and even if I can't work with you or you're in another country, I'm not licensed in your state or whatever, I can connect you with somebody that would be helpful generally, or I can point you in the right direction. So I always tell people this is about you getting help, not me working with you. Now I would love to be the one to help you, but I don't have to be.
Okay. I like that. That's important. That's a great message. Well, Chad, I really appreciate this time, man. Thank you for walking myself and my audience through some of the ways that you treat OCD, and I think that we're definitely going to have room for future conversations as well.
Yeah, absolutely. Thank you very much.
Okay. You have a good night.
Likewise.